Before I start, I just want to tell about the medical disclaimer. You should always consult your doctor before you start to use these medicaments. I'm just here to teach you guys and showing my experience. So many people have asked me, oh, how can I get better hair? This is obviously for men, specifically for men, but everyone can listen to learn about it. So today we're going to talk about 4 medicaments which I'm taking currently for my hair loss protocol or improved hair quality and strength. Because for the past 5, 6, 7, 8 years I have had thin hair it's been diffuse thin hair called telogen effluvium in the medical term, and this is a condition where your hair is getting thin, spread out on your scalp. Necessarily it's not losing hair, but it just get thinning of the hair. So it's different, it's different from hair loss, which you actually lose hair by genetic condition or other condition or other causes. But this is a condition called telogen effluvium, meaning that your hair gets thinner, spread out on your scalp. So this you can actually prevent or actually fight against. And currently I'm using 4 medicaments which I'll explain now. So the first medicament here I'm going to talk about is Finasteride. Here you have it. Finasteride Actavis 5 milligrams. So I've been taking this since January. You need doctor's prescription for this one, and so each pill is 5 milligrams of finasteride, and obviously this amount of finasteride is for benign prostatic hyperplasia, which is a condition of your prostate, obviously for men. Only men has prostate. Which is through treatment of growing prostate, meaning that, for example, men can have problem urinating, they can have pain when urinating, they don't have control over the urination, they have to wake up at night to urinate. All this can cause by getting an enlarged prostate, which is really common in men which are getting older. So this is the medicament for treating this condition, but then you have to use the 5 milligram dose. We are not using the same amount of dosage for the hair. If you want to treat androgenic alopecia or for the hair, we are using the less amount. The recommended dosage is actually 1 milligram every day, but I'm using actually even less than that because this has side effects, and I want to minimize those side effects. I want to take the least amount of dosage with the least amount of side effects with as much effect as possible, if you know what I mean. So what I've been doing is that, for example, instead of buying 1 milligram, which costs actually more, I've been buying this pill divider here. You can see, focus there. So this can divide the pill. So what I do is that, for example, I put the 5 milligram in here, 5 milligram, and I divide it into 4 pieces. I cut it like in 2. And so 5 milligram divided by 4 is 1.25 milligram, which I take about 2 to 3 times a week. Sometimes I forgot to take it, but that's not a huge problem because this is not a life-threatening condition. Obviously, you can consider taking it 2-3 times a week to just reduce DHT, because the mechanism behind this medicament is that it is inhibiting an enzyme called 5-alpha reductase, which is an enzyme which converts testosterone into DHT. The DHT is a dihydrotestosterone, which is another hormone which makes your prostate get larger and also causing hair loss in men. So if you're reducing that one, you're actually preventing those mechanisms which are normally going to happen, So that is finasteride, and you have to be careful for the side effects, which is problem with erection, libido, and all that stuff. But if you're taking really low amount, no worries. Especially if you're eating healthy, have a good diet, working out properly. If you have a young age, overall life condition, I mean general, how to say it, overall health, if it's good, so there's no problem with the side effect can be minimized. You can take it in basically any time of the day, but 2-3 times a week is fine, because then if you consume 3 times a week, it will be 1.25 times 3, that's let's say 3.75 milligrams, which is actually half of the recommended dosage for the whole week, because recommended dosage is 1 milligram every day for a whole week, so 7 milligram in the end of the week, and we are actually taking 3.75, which is actually half of the recommended dosage, which I do. And that is Finasteride. And for women, listen up. These medicaments can be harmful for male babies. So if you're planning to get pregnant, or if you are already pregnant, then you should not come closer to this medicament, or you should not handle it. Don't even come in the same room, because the dust of the medicament can harm the baby and it can cause birth defects. So that's Finasteride, okay? Number 2, we have Minoxidil, which comes in a bottle like this. This is not a pill like Finasteride, this is actually a spray which you can spray on your scalp, and you can massage it kind of. Minoxidil, 5%, and I buy it like this in the 3 packages. This is in Poland, so I buy it here. Focus. Yeah. So this will last me about 3-4 months, because I use one bottle about roughly 1.5 months, because this one you have to use in the morning and in the evening. I think about 5 to 6 pumps, like 5-6 pumps, spread all over your scalp, and then you massage it kind of. It will be sticky, but then you just wash your hand and you're good to go. This medicament was actually treating, back in the days, hypertensive patients, meaning that people who had high blood pressure, this was one of the medicaments, because this makes vasodilation, meaning that your blood vessel gets bigger, which is causing your blood to move slower, because you can think of it like if you narrow a pipe, for example, the pressure is higher, you know, because you're actually squeezing the area of the flow, and it will go faster. So if you're actually widening that pipe, the flow will get slower. You can think of it that way. So this was one of the medicaments back in the day, and back in the day they used it like a pill, and they saw like a hair growth in patients. So instead of growing hair all over the body, why don't just use it topically, locally, you know? So locally on the hair scalp, you can spray it on, and it will grow. Actually, it can make your hair grow more or better or stronger. But the bad thing is that only 40% of the people who use this medicament will actually respond to it, because, you know, but you can use microneedling to improve the effects even 2-3 times more, because studies has shown that if you use microneedling with minoxidil together, you will actually 3 times or even 4 times the effect. I will show you a graph here, and I've written an article which you can read in the description below. I've written everything, so you can go back to the article and read about it. You can have it on paper, it will be easy for you how to manage. Minoxidil, you can use it in the morning and evening, just spread it apart. It doesn't have to be exact time every day, but after you wake up and before you go to sleep is fine. Another thing you have to remember is that when it comes to minoxidil, don't use it after microneedling, because I will tell you now about microneedling. So let's take it, microneedling device. So this is a microneedling device. This model is called Dr. Pen, and this is actually a really good one because it's really portable. You can see my hand, it's really small. You can see I can take it anywhere, put it in the pocket and travel anywhere with it. So what you have to consider is that derma pen, which is this one, is different from derma roller because derma roller is kind of different mechanism. I will explain you. Let me just take this so I can explain you. Okay. Let's say you have a derma roller. Okay, you roll it on your derma. Derma means skin. Okay. So let's say you have needles here and you roll it on your skin. You roll it kind of. Okay. And you can think of it like when the needles goes in, it goes in an angle and it comes out in an angle. Let's say this is a needle. When you roll, it will go in like this, and you roll it and it comes out. Just imagine you create a V-shaped injury when you roll. This is not the ideal situation because you cause a more unnecessary bigger injury, which is not what you want to do actually, but I recommend you that you use a derma pen, which is this one, this device. This is much faster because this is electronic. You just charge it. You can hear the sound. Yeah. So you use needles which comes in the packages which are sterile. After each usage you have to throw it out because if you use it multiple times it can cause inflammation and bacteria, which you don't want. So you just put it in the machine, I mean this device, you plug it in and you just start working. I will show you guys later how exactly you will do it, but you will just start working on your templates and your scalp. And the mechanism is that, how the mechanism works is that, for example, when you cause these micro injuries, when the needles goes in and out like this in your scalp, okay, it goes in and out. So what happens is that your body will regenerate, especially platelet. Platelet derived growth factors will be activated, and platelets are really important for regeneration. So this increased blood flow to the scalp also, and the increased platelet derived growth factor will actually regenerate your scalp and can produce thicker and stronger hair, especially when you use it with minoxidil. Especially, they're like best friends, you know. But the thing is, it is slightly painful. You'll see small blood spots, but that's completely fine. You just wash it off after microneedling session, and you have to be aware of that. You will have a slight pain for one day, you know. But don't go to the barber the next day. You have to wait at least 2 days because the barber will comb your hair hard and it's painful. So keep that in mind. So I recommend the derma pen instead of derma roller because of the reason that derma pen makes actually straight channels into your scalp, like this. You know, straight channels, not like derma roller in an angle. Of course that derma roller is cheaper than derma pen, but you have to be aware of that angle because the derma roller goes in like this and out, as I explained earlier, and derma pen creates straight channels. But the good thing is that when you buy this one, it will last you lifelong. You know, you just charge it, but the thing is you need to buy these needles. I always buy like 30 packages at once, so I will have it for 30 weeks, 32, 35 weeks, because each one is used every week or every 10 days. So I have the whole package here. You can see. So I bought it back in March and I still have it. So I use this, as I said, every 7 to 10 days. And I really plan it because let's say if I'm going on a vacation or a trip, I just do it 1 or 2 days before. So when I come back, it's time to start another session, you know. I don't actually have the session planned during my trip. That will be unnecessary, and you also need to take it with you. So you save luggage space, you save time, and you know. So that is the microneedling therapy. How often you should do it? Once every single week or every 7 to 10 days. Keep in mind that you have to change the package after every session because it can cause bacteria and inflammation if you're using it multiple times. And also really important is that when you open the package, use it. Don't you open and leave it and go eat, play games and come back, you know. Do the stuff you have to do first with this stuff and then throw it out, because you're dealing with your health here, okay? So keep that in mind. And also important thing is that when you use microneedling, don't use minoxidil. You have to wait minimum 24 hours. I will explain you why. Listen up. So when you use microneedling, do you remember that I said you create straight channels? And do you remember I also said this was treating hypertensive patients back in the days? So yeah, you can think logically what will happen. When you do microneedling therapy, you already made these straight channels into your scalp, and then when you use minoxidil. So what will happen when you use minoxidil straight after microneedling session is that you have now created the straight channels into your scalp after microneedling session. And when you use this minoxidil, what will happen is that this medicament will go systemically into your body, and it can cause heart palpitations and other side effects which you don't want, because this medicament minoxidil was used for treating hypertensive patients, so it can cause hypotension, meaning your blood pressure will drop and you can faint even, you know. You have to be careful. Just listen to what I'm saying and you'll be fine. Always consult your doctor if you're not sure how to do it, and any other information if you are concerned, okay? So if you do, for example, microneedling session in the Sunday morning, I recommend you that you can use the microneedling, let's say Monday evening or even Tuesday morning, minimum 24 hours. Me personally, I have set the time that I will use the microneedling session every Sunday evening because it's easy to remember, and you know, Sunday evening is a time for relaxing, so I just do microneedling session, meanwhile I watch some YouTube or any other stuff, you know, so I can multitask. And I will now show you guys how to do microneedling. So follow me and I will show you how you can do it.
What up? So this is how you do it. Let's go. Alright, look. Just go and work in one place and make like 5-10 rounds, and then you move to the next area, like zzz, and then here, zzz, okay? Like work on the templates here, right here, even here, like this. A little bit painful, but that's fine. Okay.
I will now explain about the fourth medicament. The fourth medicament is Ketoconazol Shampoo, brand shampoo named miseable, and the active ingredient is ketoconazole. I don't have the shampoo right here, but I have it in the previous footage and I can show you. So this shampoo you can use every 2-3 days. And what it actually is used for is that it is used for treating flaky scalp. A flaky scalp is a fungal condition where you can see white patches on your scalp, and this medicament is used for treating that. But it's also another thing is this shampoo does, or this active ingredient does, is that it is a mild DHT blocker. This is the mild dihydrotestosterone blocker, compared to Finasteride, which is a strong blocker because it's inhibiting the enzyme. So it's kind of removing DHT. But this shampoo is a mild blocker, which actually can improve your hair health, which is documented and research about. So if you can use this shampoo every 3 days, that's really good. Because most people are using shampoo anyways. So you can just use this shampoo. Instead of buying other shampoos, you can buy this one and you can use it every 3 days and you're good to go. Other things you have to consider is that don't shower in really hot water. Don't use hair dryer because of the heat, it can damage the hair. Also, don't stay in really heated areas, situations which are not ideal for the body, you know, increased temperature, for example, and other stuff. And you don't always have to shower with shampoo every day. If you are showering every day, use the Minoxidil shampoo every 3 days and you're good to go.
So guys, this is actually my whole stack. So I just bought the Minoxidil shampoo, so I will explain you guys the different parts, okay? So here we have the Dr. pen, which I just explained you guys. Dr. pen with needles. These cartilages contain 16 needles per cartilage. This one is called cartilage and it has needles, and I will soon show you guys how I do microneedling, how I do my microneedling session. So basically I buy a lot of these cartilages at one go, so I have it for a long period of time. So here I have a package. You see, I have a lot of them. So this will last me for about 9 months, I think. So let's put it aside. So each of them you are using for every 7 to 10 days, alright? And I will soon show you guys how you do this stuff. So let's talk about the other stuff. This is Finasteride, like I showed you, with my pill cutter right here. And this is used for cutting the pill. So I put the pill here and I divide them. I break them in 4 pieces and I take 1/4 of a piece each 3 days, like I explained earlier. Then here we have my Minoxidil. This is a spray. Preferred amount is 1 milliliter each time you apply, which equals about 5 to 6 pumps. Full pumps, okay? 5 to 6 full pumps. This is Minoxidil. This is a Minoxidil. This is shampoo. I'll just open up and I will show you guys. Hold on. Let me just open it. So it looks like this. Minoxidil. The active ingredients is Ketoconazol, as you see right there. Ketoconazol, obviously I bought it in the pharmacy in Poland, so it's in Polish, but the active ingredient is Ketoconazol, 20 milligrams. So all this stuff right here is really essential and is part of my hair loss protocol. I also written an article about this on my website, so keep that in mind. And yeah, that's it. Finasteride, Minoxidil, microneedling with cartilages, and yeah, that's it.
So another thing I want to talk about is when you go to the doctor and consult about this situation, they will tell you that they have a recommendation and they will tell you that you can consider using, you consider a PRP treatment. Okay, PRP it's nice, it works, but I will tell you guys why they say this. First of all, doctors when they recommend you PRP, they know that it costs more money than this protocol which I've just explained you, and it will make them more money. Okay, doctor, you want to earn money, but come on, I don't want to spend 1,000 euros to just improve my hair quality, you know. Because normally the general average price of each PRP treatment is 400 euro. I'm saying euro here so you can convert it into your local currencies, because in Norway one PRP session costs 4,000 Norwegian kroner, so 400 euro roughly. And PRP, you have to do it once every month for 4 months, and then you have a break, and then you have like once every 6 months, and then you have a maintenance phase for one every 12 months. So imagine, it's so much money, expensive just to improve hair quality. This protocol means that this is a regimen. This regimen I'm using is so cheap. It's like, okay, you pay 1,160 euro for the Dermapen, 40 euro for 1.5 year supply of Finasteride, Minoxidil, which cost about, let's say, 20 euro every 3 months, and Ketoconazol Shampoo, which is like 2 euro for each bottle. So cheap. So think about it, it's crazy. But I'm not saying PRP doesn't work. It works. PRP is a good treatment, and it's logically and is well documented as well, with minimal side effects, because PRP because PRP is the short term for platelet-rich plasma. It says in the word. They draw your blood plasma, they centrifuge your blood, they spin it, so your red blood cell, white blood cell and platelet will separate. They draw the platelet out of the tube with the plasma, and they inject it in your scalp. And to be honest, platelets are important, yes, for regeneration, and they are important for the healing process and blood clotting as well. The thing about PRP is that it costs money, and doctor will recommend you this because you have to pay to the clinic and you make the clinic more money. You have to keep that in mind, but you just have to consider it yourself, you know. So that's why I said earlier about the microneedling therapy, that it's responsible for platelet-derived growth factor. PRP is in similar fashion. It also causes platelet-derived growth factor and regeneration. So those two kind of treatments are in the same, they are almost similar, I could say. But obviously microneedling is cheaper if you do it at home, of course, because you can also do it in the clinic, but you have to pay much more. I recommend you just learn how to do it, because it's not so hard, and buy a derma pen and buy multiple needles, let's say 30 needles each time, 30-40 needles, so you have it in the long term. Each needle costs about 1 till 2 euros, depending where you buy it from, and you can just buy, let's say, 30 needles in one package, and you can use it for half a year or even more. So this was my regimen, which I'm using since January this year. I really recommend you to consider it, because it has minimal side effects if you follow certain guidelines, and you won't regret it. This regimen which I showed you is much more convenient, and it's more economical for you. It's cheaper, so it's up to you what you want to do, but the mechanism is the same. PRP, I'm not saying PRP doesn't work. Obviously it might work, it can work, because the thing is, PRP is old treatment method which is used for healing injuries, and it can provoke better hair and increased hair growth, because platelets are responsible for regeneration, and the same method applies when you do microneedling. Microneedling session would actually induce platelet-derived growth factors, which is almost the same like PRP, because you are injecting PRP platelet into your scalp, and this will actually cause regeneration and stimulate hair growth. So the kind of same mechanism here, but it's much more expensive, because each PRP treatment costs about 400 euros, and you have to do 4 sessions separated each month, so 1,600 euros, and then you have to do each every 6 months to maintain, and then you have to do each every year to just maintain. It's so expensive, but in the end of the day, it's your choice. I'm just here to give my opinion. Thank you guys for watching. I have written a full article about this on my website. The Minoxidil, Finasteride, microneedling, Ketoconazol, PRP, some comparison, my final take, and some other words. Feel free to comment down below if you have any questions. I'm happy to answer them. And yeah, see you guys in the next video. Peace.